Hi friends, good evening. Once again, welcome back to my channel Mogambika Nursing. Friends, here we are discussing questions for RRB Nursing Officer exam preparation. Also, these questions will helpful for your other nursing officer exam preparation. Here we are discussing important questions and answers for exam. Today's question we can see which one is the synthetic form of vitamin K. Options: Option A, menaquinone. Option B, menadione. Option C, hydroquinone. Option D, phylloquinone. Our question is, which is the synthetic form of vitamin K? And the correct answer is, it is option B, menadione. Menadione is the synthetic form of vitamin K. There are three types of vitamin K: vitamin K1, K2, K3. And vitamin K1 is also known as phylloquinone. Vitamin K2 is known as menaquinone. Vitamin K3 is known as menadione. Vitamin K2 is both a tissue and bacterial product, usually derived from vitamin K in both cases, and also is usually found in animal product or fermented food. Move on to the next question. Which is the most potent antioxidant vitamin? Options: Option A, vitamin A. Option B, vitamin C. Option C, vitamin D. And option D, vitamin E. Question is, which is the most potent antioxidant vitamin? And the correct answer is option D, vitamin E. Vitamin A, C, E, all antioxidant, but our question, most potent antioxidant vitamin is vitamin E. And the next question, which vitamin have anti-infective property? Options: Option A, vitamin A. Option B, vitamin C. Option C, vitamin D. Option D, vitamin E. Anti-infective property is having vitamin A. Option A is the correct answer, anti-infective vitamin. And the next question, which vitamin helps in iron absorption? Options: Option A, vitamin A. Option B, vitamin C. Option C, vitamin D. Option D, vitamin E. Vitamins which helps in iron absorption is vitamin C. Vitamin C enhances iron absorption. So vitamin C helps for iron absorption. Move on to the next question. Which vitamin helps in calcium absorption? Options: Option A, vitamin A. Option B, vitamin C. Option C, vitamin D. And option D, vitamin E. So calcium absorption will help by vitamin D. Option C is the correct answer. For calcium absorption, vitamin D is essential. And the next question, which vitamin is getting only from animal sources? Options: Option A, vitamin A. Option B, vitamin C. Option C, vitamin D. And option D, vitamin B12. Vitamins which is getting only from animal sources are vitamin B12. Vitamin B12 is also known as cyanocobalamin. Move on to the next question. Burrow ink test is used to diagnose. Options: Option A, typhoid. Option B, typhus fever. Option C, scabies. Option D, diphtheria. Burrow ink test is used to diagnose scabies. Here option C is the correct answer. First option, typhoid. The test which is used to diagnose typhoid is Vidal test. And Whale Phillips test which is used to diagnose typhus fever. Schick test is used for diphtheria. Here scabies. Burrow ink test which is used to diagnose scabies. Move on to the next question. Paul Bennell test is used to diagnose. Options: Option A, Epstein-Barr virus. Option B, typhus fever. Option C, scarlet fever. Option D, phenylketonuria. Paul Bennell test which is used to diagnose Epstein-Barr virus. Option A is the correct answer. Second option, typhus fever. Whale Phillips test which is used to diagnose typhus fever, as already saw in the previous question. And Dick test which is used to diagnose scarlet fever. And Guthrie's test which is used to diagnose phenylketonuria. And the next question, sweat chloride test used to diagnose. Options: Option A, carpal tunnel syndrome. Option B, scoliosis. Option C, scarlet fever. Option D, cystic fibrosis. Sweat chloride test. And the correct answer is option D, cystic fibrosis. Sweat chloride test is used to diagnose cystic fibrosis. Fallon test, which is used to identify carpal tunnel syndrome. And Anthem test, which is used to find out scoliosis. And for scarlet fever, Dick test. Move on to the next question. When monitoring a client who is taking benzodiazepine, the nurse should be alert for which CNS side effect? Options. Option A, blurred vision, anorexia, dysarthria. Option B, seizures, tremors, diaphoresis. Option C, ataxia, sedation, dizziness. Option D, libido changes, edema, dystonia. Here the question is, a nurse is caring for a client who is taking benzodiazepines. Examples for benzodiazepines are clonazepam, diazepam, lorazepam are some example. Here the patient is taking benzodiazepine. What CNS side effect should the nurse will be alert, or she will be checking frequently for the patient? What are the CNS side effect of these medicines? That is the question. Here the correct answer will come option C, ataxia, sedation and dizziness. Option C is the correct answer. Side effects of benzodiazepines include sedation, drowsiness, dizziness, blurred vision, also ataxia. Also, blood dyskaryosis like decreased platelet count, decreased WBC count and hepatotoxicity can occur due to the intake of benzodiazepine. Move on to the next question. The nurse has just administered ibuprofen to a child with a temperature of 102 degree Fahrenheit. The nurse should also take which action? Options. Option A, plan to administer salicylate in 4 hours. Option B, withhold oral fluid for 8 hours. Option C, remove excess clothing and blankets from the child. Option D, sponge the child with cold water. Here the question is, a nurse is given ibugesic syrup or ibugesic ibuprofen to a child of temperature is 102 degree Fahrenheit. So after giving the medication, what action does the nurse should take? That is the question. Here the correct answer is option C, remove excess clothing and blanket from the child. Option C is the correct answer. First option, plan to administer salicylate. We will not give salicylate to the child, and oral fluids we can give, we should not withhold. And sponge the child with cold water is there, so we will not give cold sponging. Remove excess clothing and blanket from the child, so after giving there will be fever will be reduced, sweating will be there, so we have to remove excess clothing and blanket. Also we can give tepid sponging to the patient baby. Move on to the next question. Age-related loss of muscle mass, strength and function is known as. Options. Option A, neutropenia. Option B, sarcopenia. Option C, osteopenia. Option D, thrombocytopenia. Our question, age-related, due to aging, the loss of muscle mass, strength and function is lost. That is known as sarcopenia. Option B is the correct answer. First option, neutropenia, means decreased in number of neutrophil count, that is neutropenia. And osteopenia means option C, a loss of bone mineral density, which may lead to loss of strength of the bone. And thrombocytopenia means low platelet count or decreased platelet count. Here the correct answer is sarcopenia. Today again we discuss some of the important questions. If it is useful for your studies, please share my videos to your friend circle.